Welcome to Midday. Our first guest joining us, Amanda Manholt, of course, with Skin Kamloops, and we're talking about another procedure, and this is a really interesting one called microneedling. Thanks for being here, Amanda.
Thanks. Always love to come and visit.
You brought all the tricks to microneedling, but before we get to what you have on the table here, what is microneedling? How do you explain that to people?
Microneedling is a procedure that can be done to improve the quality of the texture of the skin.
Okay.
So
like the collagen?
Exactly.
Okay.
Another name for microneedling is called collagen induction therapy.
Okay.
And in terms of non-invasive cosmetic procedures, it's actually fairly new. It hasn't been done for a very long time. It started with just a single needle where people would go in and make a very small wound into the skin, like a little puncture into, say, for example, a scar.
Right.
And it's involved to something like what you see on the table here, which is the microneedling. We use the DermaStamp or the by DermaSpark machine.
Okay.
This is recognized by Health Canada, and it's a medical grade piece of equipment.
Can you get this done anywhere on your body, or is it specific to one place?
Yeah, pretty much.
Okay.
So typically people would come for microneedling if they had concerns with texture in their skin. So commonly we're going to see people treating fine lines and wrinkles. Most commonly it's actually acne scarring.
Oh, interesting.
So with acne scarring, you can be left with the aftermath isn't great. So you can have things from ice pick scars to boxcar scars to rolling scars. All of these can be addressed with microneedling. The other thing is actually for stretch marks. So people can treat stretch marks oftentimes after pregnancy or if you've had a severe weight loss or weight gain. So the idea behind it is it makes very small microscopic punctures into the skin.
Right.
And those punctures go into the dermal layer. And what that does is it tricks a cascade response within the skin that your body says, danger, danger, let's go in and fix that.
Oh,
those fibroblasts go in and start making more collagen and elastin, and you get that more dense tissue underneath. And that's how you start to get that smoothing effect on the surface of the skin.
So what you brought, so this is the actual device here?
This is the device, and it's got a little pen, and then what we use is, of course, a single use. These are sterile, and there's 6 tiny little needles in there. And then there's different...
6 little
Yeah,
needles
if you look
there.
Inside, you can see them. They're really small.
Oh, I see them. Okay.
Yeah.
Wow, those are really
They're
micro.
teeny tiny. Yeah. And then there's a depth setting. So if you touch your face, you'll notice your forehead, there's not a lot there of tissue, but your cheeks are quite deep.
Yeah.
So whoever's doing this has to have a very strong understanding of the skin and also skin response. So they're looking for pinpoint bleeding. It's not like when you see things online, like the vampire facial, people all covered with blood. That's not what this is.
Okay.
There isn't a lot of it, but
Like the Kim Kardashians and them, they always do that vampire face thing.
Yeah, and you wouldn't put actually red blood cells on the skin because it would just cause more inflammation.
Right.
So having said that, you want to make sure that the technician that's doing it has a lot of experience and a very good understanding of skin response. So we will use something called hyaluronic acid, and actually we still do it sometimes with hyaluronic acid, but what we do most is PRP, or platelet-rich plasma.
Okay.
So what that is we do a blood draw, about this much, so not a whole lot. We spin this off in a centrifuge. The red and white blood cells drop to the bottom, and what you're left with is liquid gold on the top, and that is your own PRP, or platelet-rich plasma. So it's full of growth factors.
It's very natural, the whole thing, right?
It is. You're putting
really coming from you.
It is. So if it doesn't work, it's your fault. No, I'm just kidding.
You can only blame it on yourself.
So the growth factors in the PRP just stimulate everything and make it work better and faster. So something to be aware of if you are going to do microneedling, if you're interested in getting more information, do your research. There have been cases where people have used serums that are meant for actually topical application on the skin, not meant to go in the skin, and have had adverse side effects like permanent granulomas and things. So be very, very careful.
It may not be for everyone, but do your research.
You want to make sure that whoever's doing it knows what they're doing.
Yeah.
And again, I think PRP is the way to go, in my personal opinion. And if they have more questions or if they're interested, the best thing to do is just give us a call at the office.
Absolutely, and there's the information right there. We're out of time. Thank you, Amanda. That was a lot of information.
Sorry.
You are so knowledgeable and fantastic as always. If you want to know more about microneedling, you can get a hold of Skin Kamloops with the info on the screen. We're back in 2 minutes. Stay with us.